Right. I'm here with Shams Azad, who is the Chief Operating Officer of BRAC in Bangladesh. Also joining us from India is DSK Rao, who's been my colleague on these interviews with financial first responders. Shams, tell me about the situation in Bangladesh. What impact has the coronavirus had there? How is the government responding now?
Right. So till now, officially, we know that in Bangladesh there are 33 identified cases. So government is actually taking a lot of initiatives to combat the situation. For example, yesterday we received a directive that from 26th March to 4th April, there will be a general holiday for all government or semi-government or non-government institutions, but the staffs are asked to remain in the base so that if any support required, they can provide that. And there are some restrictions in border ban in arrivals of foreigners through 11 land ports in Bangladesh. Also, government has restricted international arrivals from 10 or 11 countries who are badly hit by the virus. Apart from that, there is also closure of educational institutions. And also we are highly encouraging mass people to maintain the basic rules of fighting this virus, that is maintaining the social distance, which is a challenge in a country like Bangladesh. So awareness is very much required. So all of us under direction of government is actually promoting hard this awareness thing. Apart from that, regularly washing hands and using masks wherever possible, all those things. And there is also government central institute, IDCR. These institutes actually helping the entire nation to combat the situation. So they have the hotline numbers. So people are encouraged, if found with any sort of symptom, people are encouraged to call this number and take suggestions. And so these are the major.
And Bangladesh has lots of migrant workers around the world. Are their jobs ending during this crisis? Are they all coming home now?
There are actually regular flow of migrant workers every month. They are visiting home, or it can be anything. So the government is suggesting the incoming migrant workers to remain in the house in self-quarantine mode. And also the partner organization government is trying to help the incoming workers so that they actually comply with this suggestion.
Okay, so incoming workers are supposed to stay in their home for 2 weeks after they get back. Right. And what about for BRAC? Shams, the BRAC, you have what, 7 million microfinance clients. You have a couple 100,000 in your graduation program, plus you have a huge health program and education. How is this all affecting your operations?
Right. So, yeah, From BRAC, first of all, let me tell you what are the things we have started doing for the last couple of weeks. Then I'm coming to that part, that how our program participants or clients are responding to those activities. The first thing what we started doing is we developed a very structured way. How do we safeguard our people, our staffs first? Because we have a huge staff base on the ground, and if we and we will be actually taking their support to disseminate the awareness message to the community level. So their safety standard is a very priority for us. So from the very beginning, we have installed proper hand washing facilities for more than 2,000 branch offices, and it was made mandatory for all the staffs, the clients who were visiting the branch offices. And one more section is important in the branch office, that is the accounts where cash transaction happens actually. So we made it very clear to the accounts officer that while transaction, they need to be having protective tools like mask or gloves, and they should be keeping, say for example, tissue boxes and covered bills, so that if any clients are found to be coughing or sneezing, they will be actually raising awareness to the clients to use those tissues and other things. So these are the basic level of things we started from the very beginning. And also we provided hand sanitizers and face masks and gloves to our staffs. Microfinance staffs who goes to the group to collect the cash, they are highly suggested not to collect the cash in the open hand, with the open hand, and why after the collection they should be putting the money in a paper envelope, and after they give it back to the branch account officer, they need to destroy the paper envelope. And group members are also suggested not to come all together in a group. They could come sporadically one by one, and wherever possible, we also ask the group members to arrange hand washing facilities during the group members visiting time. So another thing is with our, as you know, we have many other programs. So with our health programs, we developed a training module, which is a combination of audio video content and presentation. So this was being shared with all our staffs within a very short possible way. And right now, many of our staffs are using tablets for the transaction. So we deliver those contents in those tablets. So that is how also we try to aware all our staffs very quickly, so that they become very serious about it, and they do not make any delay for further rolling out activities with our communities. And last week, from this week actually, in BRAC head office, where actually more than 2,000 people, we work together. We went in an office from home modality. Many of the commercial organization or private organization in the capital city are doing that for the last 1 week. So actually in BRAC head office, almost 2,000 people, we work together, we dine together in the canteen. So that becomes very risky. And here more than 60% are female staffs. So we actually went for the office from home modality. And for the staffs in the branch offices, we gave the directives that if any staff shows any sort of symptom, they should be immediately sent to their residence for a self-quarantine mode for a couple of weeks. And also they can contact with our designated health experts in head office, and with their suggestion, they will take further actions. And if anyone is identified with the COVID-19 virus, then we have given directives to actually contact tracing who are the staffs they work with in the office. If it is more or less almost all the staffs, then we would be actually shutting down the entire office. Then colleagues from the office adjacent, they will come and actually sanitize the entire office with the help of local workers. Then in the office, these are the things we actually triggered. And yeah, so
And
and
how
for
is
the
this affecting your clients now? How are, are they seeing less business? Are they having difficulty making money in the midst of the crisis, or are things going on as normal in rural areas?
Yeah, so the first thing what we did with the clients was we went to them with leaflet,
Yep.
and contains all the basics of fighting this virus, and the clients really appreciated our the way we actually communicated. And there were a lot of misconceptions, there were a lot of misunderstanding about the
Right.
thing. Also, there were local level myths as well. So in many places, it seems like we were the first who went there and talk about these things.
Mm.
So they really appreciated it. So at the same time, there are some hiccups also, because when our staffs went to them, some of the microfinance borrowers where the thing is already affecting. So yeah, the community is saying these are the challenging time to actually have the financial transaction.
Right.
So that's pretty much understandable. And for many business persons, it becomes tough to come to the branch office anymore to do the transaction. That is also pretty much understandable. And also these are the times what we see that in community level, people are not in that mindset to do financial transaction right at
Right.
this moment. They're more concerned about the health issues, and they
Right.
want to know more about these things. So we have taken decision actually to close down the collection from 26th to 4th April as well, and at the same time, uh, we we will be continuing disbursing, because still we think that
Mm.
many clients who are doing business, especially in the medicine and food businesses,
Right.
they probably will
Right.
need money.
Right.
And already we have probably the commitments which we made in the last couple of weeks, we ought to disburse those amounts. So we'll be doing some quick disbursement in next few days. After that, we'll be very careful about disbursements also.
Mm-hmm.
And this time, any client can come and withdraw their savings as much as they want, because this is also important. So
Right.
for that reason, we are keeping our offices open till now. We are not saying that we are going to close the office entirely, but to keep alignment with government directives, what we are saying to our staffs that you should be staying at your base. We will not be doing regular programmatic activities, but we will be continuing giving the awareness messages, the communication materials to our community people as much safely possible. So yeah, and apart from microfinance staffs, there are more than 40,000 health workers who are working with our
Right.
health program, and
Right.
also the ultra pro graduate
Right.
officers. These health workers and ultra pro graduate officers, they are going to house. So
Okay.
they will be going with stickers. They will be pasting that sticker in their door or their wall. So these are the things we are doing.
So the
So there
stickers
is
give
discomfort
health
in the
messages,
community.
tell them what to do to avoid transmission of the disease.
Very basics, the symptoms
Right.
and and the contact numbers, the
Okay,
government
very
contact.
good. Very
And
good.
at the same time, all our staff's numbers are available with all the clients. Anyone can call us
Right,
anytime
right,
what to do. We helping them. But what we are feeling that there is discomfort within the community. People are getting to know about it, and people have started actually taking some actions on the basic hygienes of hand
right,
washing, social
right,
distancing. But yeah, yet to see how things will move out.
right, right. And what about if this crisis continues, if this distancing needs to take place for 3 or 4 months? Do you know how you would respond as an organization to that?
Yeah, so we are still talking about some of the measures. We are engaging our donors and working partners heavily on framing out how to actually combat if the situation goes up to 3-4 months. So one thing is coming up that is right now we actually need to help Bangladesh government on the medical support part.
Right,
Actually, if we apply with PPEs or face masks
right,
to some of medical facilities or our workers, then and in many cases some government officials also has taken our leaflets
all right,
to distribute it through their channel also. In cases that also happen. So these are the things we are doing, and from tomorrow we will be going to mass newspapers, television commercials for greater awareness. So these are the some of the upcoming activities we are doing.
mm-hmm.
So another thing is coming up, that will be on what we can do on the livelihood part, because a lot of low income workers, they will
Right,
be heavily in urban areas, also in rural areas. So this one we really need to work with government, taking the suggestions and also taking suggestions from our donors and international communities. We need to figure out how as an organization we can help on that part. So apart from that, the government the plan of setting up new facilities for the testing or the isolation units across country,
right,
as an organization definitely will be able to support as much possible from our end.
right.
So these are a couple of things that are coming up for the next 3
Okay,
years.
okay,
Yeah. So for microfinance, what we see that uh, even if we are actually discontinuing collection for a couple of weeks, and but what we feel that staying close to the client is very important. So
right,
we are heavily encouraging our field officers to have regular contact with our clients, either in-person visit, maintaining the social distance, or through the phone calls, so that they feel that we are just beside them. This is very important.
right,
And continuously banging on the basic awareness messages. That
right.
is really, really important for us.
Right. I imagine
Yeah.
that's huge because lots of information gets out and much of it is not correct. So making sure people get the right message about what they need to do is important at this time.
Yeah, and also, at the same time, we already have delivered almost 2 million voice messages to our
Okay.
clients.
Okay.
This being recorded from our executive director, Asif Bhai.
Right.
So his message has delivered. That message contains those 3 basic awareness, basic symptoms.
Right.
So these are the things we are doing. We are also planning to, print big size posters which we'll be putting on the walls
Right.
to raise awareness. We are planning to do all those things.
Okay.
And Dhaka, the capital, Dhaka Arba is definitely one of the most vulnerable locations. And,
Right.
out of the 39 cases, 15 were confirmed at Dhaka. So we need to do actually a lot of activities in the capital itself. Already there is a program which we call the Urban Development Program. They have almost 700 workers. They are working on the streets with hand sanitizers or running water with soaps just to raise awareness among the pedestrians. Whatever things that is coming into our mind which will be helpful for the mass people, we are trying to do that.
Right, right.
Awareness is the most important thing right at this moment.
Right. Well, it's great to hear what you're doing. I think it will be helpful for other organizations to learn from your example here. But it's such a huge challenge. I'm glad there's an organization like BRAC that has people out in every community to help get the message out and help provide care to people.
And one more thing I can tell you that just 2 days back, Mr. Shamaran, he actually sat with rest of the many major microfinance institutions through the association.
Right.
So there actually we talked about what BRAC is doing. So if others want to do some activities, we are also ready to share our contents, our materials. These are all available in our websites.
Okay.
So anyone can actually do whatever they want to do for their clients. These are the things we are doing.
Good. I'll post a link to your website so people can find it and see what you're doing. All right, Shams. Thank you very much.
Yes, Larry. Thank you very much.
I have only one question.
Go ahead, DSK.
Yeah. Are the group meetings suspended? Are you thinking of suspending them? Right now, what is the status? Microfinance group meetings.
Yes, right at this moment, we are suspending the group meetings for a couple of weeks till 4th April. And then we will take another decision after 4th April what we will do. So right now we are suspending.
So effectively,
loading the collection as well.
Yeah, collection as well as savings and everything is suspended. Okay.
Yeah. But the clients are. Yeah, the clients can come and collect their savings from the offices if it is open.
Yes, that's
because
wonderful.
in some local pockets, authorities are asking the NGOs to shut down offices.
Okay. I think it is too early to think of any interest subvention or reducing the interest rates. That kind of demand is not there from the clients, I hope. Restructuring of the loans. There is no such demand from the clients?
No, not into that discussion with the clients actually. People are more concerned about the health issue, hygiene, those things. Yeah.
Good. Thank you.
All right. Thanks a lot, Shams and DSK.
Thanks, Larry.
Yeah. Nice, Larry.
All right. We'll keep in touch, and thanks for sharing what you're doing.
Please also do share what's happening on this thing. This is a very serious situation, of course.
Right. Yeah. We'll keep sharing what others are doing as well, so you can see. Thank you. All right.
Thank you very much.
Good night.
Bye.
Bye.